Welcome, everyone. We're very excited to be hosting the Better Care, Better Jobs Act webinar today. We'll give it just one more minute and we'll allow other people to come in. I can see a flurry of names coming in already. Hello, Alan. Hello, Andrea. Hello, Chad. Hello, Christy. Welcome, everybody. Today, we've had over 500 registrants for this webinar. There's been a lot of positive feedback for us hosting this topic today. So we're really looking forward to the presentation and engaging in a lively discussion. All right, let's get started. My name is Erika Sessions, and as you can see from the title screen, I am CareAcademy's Compliance and Policy Development Manager. Just a little bit about myself. I work to aggregate assets and compliance requirements from across the nation, including best practices for home care providers, direct care workers for in-home care for older adults. I'm also involved in CareAcademy's partnership development, policy development, regulatory research, and resource creation. As of more recently, we've launched an initiative called the Career Path Initiative, in which direct care workers have their CareAcademy training translate to college credits at top higher education institutions, such as Southern New Hampshire University or SNU. The Better Care, Better Jobs Act has really specific intentions and focus around home and community-based services, including workforce development and access enhancement. Our guest, Robert Espinoza from PHI, who I will introduce in a minute, will talk more about that and how legislative change is going to be the driving force in accelerating home-based care services into the future. Just before I introduce Robert, I'll give a quick refresher on what is CareAcademy. CareAcademy provides high-quality, state-approved caregiver training for home care agencies that increases caregiver knowledge. Caregivers love to complete all their training needed from an easy-to-use, mobile-friendly platform designed around their style of learning. Home care agencies know their caregivers are current with their training requirements and are able to manage their compliance needs. I see a lot of CareAcademy customers on this call. Hello again to all of you. If you're not a customer, you can check out our website where you can sign up for a free trial, try out CareAcademy without any commitments for 14 days. You can try adding a caregiver, check out our classes. If you're currently a ClearCare, Access Care, LiaCare, or ERSP users, we integrate all of those back office systems, so you'll be saving a ton of time as you onboard and assign them training. Lastly, our compliance automation and compliance logs make sure that you're always ready with compliance reporting in hand for when an auditor knocks on your door. Moving on to the next slide, we're very excited to have with us the Vice President of Policy at PHI and also a member of CareAcademy's Advisory Board on this call to talk with us today about the Better Care, Better Jobs Act. Robert Espinoza is the VP of Policy at PHI, where he oversees its National Advocacy, Research, and Public Education Division on the direct care workforce. In 2020, he was selected for the first ever Care 100 list of the most innovative people working to reimagine how we care in America today, and as one of Next Avenue's 2020 influencers in aging. He serves on the board of directors for the American Society on Aging and the National Academy of Social Insurance. Thank you so much, Robert, for joining us today. I will pass it off to you.
Thank you, Erika, and thank you everyone at CareAcademy and the entire team for, one, the incredible work that all of you are doing, but also for hosting me and for having this conversation today. Also, thank you everyone who's attending this workshop. This is a critical topic. It's a critical moment in our federal history and on the workforce and on home and community-based services. So I'm hoping that it really leads to an exciting conversation about these developments. I do want to make one note about my expertise. I work for an organization that's specifically focused on strengthening the direct care workforce. And in that sense, I can speak obviously in many ways to the ways in which the Better Care, Better Jobs Act can make a real difference for these workers. I have a little less insight on the broader sector dimensions of this act and sort of the implications for things like the spousal impoverishment protections or the Money Follows the Person program. That said, I do welcome any question, any conversation in that regard. Next slide, please. Just as background, PHI, we are a national organization that's focused on strengthening the direct care workforce. We do that work through research, through policy analysis, through advocacy at the federal, state, and local level, and through designing a range of workforce interventions that are really meant to strengthen jobs in direct care and optimize their delivery of services and supports in long-term care settings. And we do quite a bit of work in educating the public to raise awareness about these challenges and also the solutions. How do we as innovators, as policymakers, how do we make a difference in these workers? And we do all of this in consultation with policymakers, with payers, with providers, and with workers. We often say that we have a 360-degree perspective on this workforce because of this, and we've been around for nearly 30 years. So we bring that wisdom to this conversation. Next slide, please. So just as context, before I go into a conversation about the Better Care, Better Jobs Act, a little bit about the workforce, which helps us understand the rationale behind this act and some of its potential as well. By direct care workforce, we define it as workers who support older adults and people with disabilities in a variety of long-term care settings. They work in private homes, they work in residential care settings like assisted living, and they work in nursing homes. Their titles do vary by occupation, they vary by state, and they vary by institutional provider or employer. So you might hear terms like home care aide or care partner example, and it's an example of the ways in which so many people are invested in this workforce, but there isn't really a unifying definition and agreed upon set of terms for who these workers are. It's one of the challenges that we face at the federal level. Our research does estimate that there are about 4.6 million direct care workers in this country, or home care workers and nursing assistants for the most part. We do know that because of growing demand that's spurred largely by growing demographics of older people and the fact that people are living longer, also because of increased turnover, because many workers are often leaving this sector for other fields, that long-term care employers will need to fill about 7.4 million job openings in direct care between 2000 and 2029. Again, these are job openings that are created from demand, new jobs that are being created, but many of them are due to the fact that poor job quality in the sector is driving many workers into other industries. And so it's an enormous challenge we have ahead of us. That said, the direct care workforce already is larger than any other single occupation in the US. And that's just a startling fact when we think about the size and the import of these workers. Next slide, please. Who are these workers? For the most part, they are women. About 87% of direct care workers are women. About 59% are people of color. And in some states, like New York, New Jersey, California, et cetera, about 1 in 2 workers is an immigrant. Nationally, about 27% are immigrants. That said, our research does look at workers who are what we might call in the formal market. It doesn't include workers who are working in the gray market, where we can imagine there are higher numbers of immigrant workers. The median age for these workers is about 43, but about 1 in 4 workers, or 25%, are aged 55 and older. So as this country has aged, so has this workforce. And that raises questions about the ways in which we create age-friendly work environments as well. Next slide, please. Unfortunately, these workers do struggle with inadequate compensation, and inadequate compensation drives many workers out of the sector. It makes it difficult for them to make ends meet. It also makes it difficult for employers to meet growing demand. Our median hourly wage for direct care workers, the median hourly wage for direct care workers is about $12.80 because many workers are relegated to part-time schedules, about 31%. The median personal earnings are around $20,000 a year. All of this means that about 45% of direct care workers live in or near poverty, and that is just a startling statistic. Last year, we did research looking at how the median wage for direct care workers compared to other occupations that were similar in terms of their entry-level requirements, or lower in terms of their entry-level requirements. And we saw that in every state, plus DC, the median wage for direct care workers was lower than every occupation with similar entry-level requirements. And I think in 26 states plus DC, it was actually lower than occupations with lower entry-level requirements. So it has become increasingly difficult for long-term care employers to compete with other industries. Next slide, please. We also want to point out that within an already marginalized workforce, the challenges are actually greater based on gender racial inequities for women of color. So our research does show that the median hourly wage is lower for women of color than white men in direct care, and the median family income for women of color is also substantively lower, about $10,000 lower than for white men. So it speaks to the need to also address gender and racial inequalities society-wise, but also within our sector to really make sure everybody's benefiting from those improvements. Next slide, please. I'll share one quote before I talk about better care, better jobs, which is a quote from a care partner in Stone Mountain, Georgia, who says, "Many CNAs do not get paid enough. You have a lot of responsibility taking care of members. When you are not earning enough money to make ends meet, many people leave to find better pay." Next slide, please. So the 5 pillars of direct care job quality, I forgot that I was going to reference this before, the Better Care, Better Jobs Act, is a framework that PHI put out last fall. And the reason I included this before we go into Better Care, Better Jobs is just to emphasize that when we think about what it would mean to transform jobs for direct care workers, compensation is certainly a critical piece of that, but there are other dimensions that need to be addressed as well. And in this framework, we address 5 different pillars and 29 strategies that span everything from training to compensation to enhancing supervision and supports. Many workers leave this field because of poor supervision, to ways to increase respect and recognition and real opportunity. So for anyone on the call who works as an employer, there's a framework on our site where we spell out all of those strategies. Next slide, please. Even on compensation alone, there are dimensions to that. So certainly many people focus on a living wage, in some cases a minimum wage is what some advocates put forward. We would argue not just a living wage, but also a competitive wage at this point so that employers can compete with other industries. But also, how do we increase access to full-time hours? How do we ensure consistent scheduling and that workers are notified when there are scheduling changes? How do we ensure that there are benefit plans depending on how your employment situation has been set up? Grief support and bereavement leave, which has been a major challenge for workers during COVID-19 as they've lost their clients in residence and their own family members during the pandemic, yet oftentimes without grief support or bereavement leave to process that loss. As well as financial support and asset development programs, and of course, access to merit, longevity, and other types of pay increases. So there is a kind of a more holistic way of thinking about compensation in the other 4 pillars. Next slide, please. So the Better Care, Better Jobs Act is a promising federal investment and a much needed federal investment in this workforce. It's also the latest, I would say, iteration of a conversation that really began with Biden when he was running for president end of last summer and early fall. Next slide, please. In late July of 2020, in early August of 2021, Biden released his caregiving plan as part of his candidacy for the presidency, where he outlined a really ambitious plan to transform the caregiving infrastructure and landscape in our country, addressing everything from expanding HCBS to improving jobs for home care workers, to expanding paid and family medical leave, and a whole range of supports that would really make a difference in the infrastructure of caregiving. At the time, the plan he put forward was more than $700 billion. And over time, especially early this year, when he introduced the American Jobs Plan, which was the first part of his Build Back Better package, that number had decreased to $400 billion, and yet it still represents a sizable investment if it were to become enacted in this sector. So the American Jobs Plan was introduced on March 31st of this year. It was the first half of his administration's Build Back Better infrastructure initiative. The second half of the initiative was the American Families Plan, and that was introduced on April 28th, about a month later. And the American Jobs Plan proposed a $2 trillion investment in infrastructure, broadly defined, right, but also including $400 billion for expanding home and community-based services and raising home care worker wages, among other benefits. I won't be speaking about the American Families Plan, but that's the second half of this Build Back Better infrastructure initiative. And that proposed about $1.8 trillion to provide affordable childcare, universal preschool, expanded higher education access, individual and family tax credits, and comprehensive paid leave. In the bipartisan package, the $1 trillion bipartisan infrastructure package that he was able to negotiate, unfortunately, the $400 billion was not included. And so the Better Care, Better Jobs Act was introduced to realize that goal. And it's in the process, of course, as Congress and the president negotiate the infrastructure package and the Build Back Better package to still become law in the next few months. And we can speak about the politics and sort of where that stands, but that's the general context for those bills. The Better Care, Better Jobs Act, in essence, would allocate hundreds of billions of dollars towards, one, strengthening home and community-based services across the country. Second, it would address disparities in access to these essential services. There are long wait lines in most, if not all states, for HCBS. And we know that even separate from those wait lines, people don't receive the adequate HCBS that they need for a variety of reasons. One of those reasons, and this is the work that PHI does, is that access to high quality direct care workers is still a challenge for people in most, if not all, parts of the country. And so the Better Care, Better Jobs Act also invests in improving job quality for direct care workers. Next slide, please. So some of the features of this act, and I want to reference specifically my colleague Kezia Scales, who wrote an article about this in early July. I include the source at the bottom of this slide, and I'm borrowing her framework and her analysis for this. One of the centerpieces of the Better Care, Better Jobs Act is this investment in building the HCBS infrastructure at the state level. There is $100 million to create what are called HCBS infrastructure improvement plans. This money would help states create these plans, and as part of these plans, they would assess their current Medicaid funded HCBS systems and really look closely at what are some of the gaps, what are the disparities, what are the areas that really need reform that this money could address in the future. A critical piece of this is diagnosing workforce challenges. We've been doing work at PHI for years, and I know CareAcademy has quite a few thoughts, and other people on this call do as well, about what some of those challenges are. But if I can name a few, that some of these challenges, of course, compensation is a major challenge. Workers do not make enough. They often do not have access to full-time hours or benefits that would address their needs as low-wage workers or as workers in general. Oftentimes, training programs are inadequate. They're under-resourced. They're not adult learner-centered. They don't have kind of the right infrastructure or evidence base to be successful. As we begin really, as virtual training approaches begin flourishing, like CareAcademy's approach in many ways, we also need a stronger understanding and investment in these approaches. How do we think about both hybrid approaches that can really bring together the in-person training and the virtual training in the best way possible? And how do we think about evaluating them so we boost our evidence base on what's needed? Of course, there are also challenges with limited career advancement opportunities, data collection challenges. We saw this during COVID-19, where many states, when the pandemic hit and when a hotspot would emerge in a certain part of the state, didn't have the data they needed to be able to say whether there were available workers nearby, right? And because of state-to-state training variance and training requirements, it was impossible for workers to go from one state to another or from one setting to another because of that variance. So those are some examples of the kind of workforce challenges that the Better Care, Better Jobs Act funding could help states address. It would also help them address how do you design services that are, one, appropriate, equitable, so they're addressing, different populations within workers, women, men, older adults, people of color, workers in rural areas, any kind of inequity that currently shows up in the system. And how do we make sure they're sustainable? So it's not just a one-time investment and we see some positive improvements for a year or so, and then we don't see it in the long term, right? How do we allow states to really think long term? And of course, how do we make sure that these plans are built with input from a range of stakeholders? We know that this is a system where so many players are affected and having insights on what this should look like, from workforce development and workforce advocate stakeholders to aging, disability, and long-term care advocates, to the private sector where we have payers and employers and agencies and so many others, right? Tech innovators, others. These infrastructure plans should really be built with all of that input. Next slide, please. A second dimension is that it's really important to note that this is about infusing new funding into HCBS. So there would be a permanent 10 percentage point increase in the federal matching rate to states for delivering HCBS, plus an 80% match for related administrative costs. And anyone who's run an agency or has run these programs know that administrative costs, are an important but sometimes a costly piece of making sure that HCBS runs properly. And so there's a real attention to make sure that those administrative costs are covered. Of course, there is an opportunity for advocacy at the state level as these plans are developed and as this money begins distributed to make sure that that money is being delivered in a way that's equitable and sufficient. But that's really meant to address the concern that states need new money in particular to be able to improve their HCBS system. And I include these bullets in broad terms, but it's really about strengthening HCBS, making sure it's accessible, it's affordable, it's equitable and sustainable, and it's about strengthening the direct care workforce so that we can improve their economic security, so that we can address recruitment and retention challenges in this sector for employers, and so that we can look at cost efficiencies, because quality jobs in direct care also can be aligned with cost savings. So that's a great opportunity for us. Next slide, please. There's also an interest in the Act in expanding self-directed services. So all states have some version of a consumer-directed program. Sometimes it's participant-directed services, self-directed, consumer-directed. There are a variety of terms out in the field. And what the Act lays out is that states would be eligible to receive an additional 2 percentage point increase for home and community-based services to establish or strengthen their self-directed service programs. This is a program that has become incredibly valuable over time. Many people often want to hire and work closely with someone they know, a family member, a friend, someone in their community, to deliver services and supports, and specifically under the idea that they are often the people who are best positioned to really deliver the kind of person-centered approaches that people want and deserve. And so self-directed services or consumer-directed services has really kind of improved and increased in its import, I think, over the last few years. And we see in our research as well, where, you know, we've been able to track how this sector of independent providers, we would call them, has really grown over the years. The Act would allow for additional funding for strengthening these programs, but it could be used for items such as developing matching service registries or other kinds of mechanisms that help connect consumers in these programs with workers, with each other, right? It could also be used to recruit and train new independent providers. I think one of the conversations I often have with my own friends and family members is that they're not aware that this program actually exists, and that there are ways in which they can work with their state to support someone they care about, and vice versa, right? And there are also ways in this act in which consumers can be supported in their role as employers. So the complexities, the intricacies that a consumer, you know, should be aware of in maintaining proper employment. This is an opportunity to think about how do we do that so that that consumer-worker relationship is as strong as possible. I do want to say one quick note on matching service registries, because this is such an important innovation that PHI has been tracking for years. This information is on our website, but matching service registries, for the most part, by definition, are online job portals where consumers in these programs can find workers and workers can find consumers, right? And they can, in the ideal, find them based on their needs, their preferences, and their availability. And so it's really about maximizing that relationship. In some states, these service registries, you know, are strong. In other states, they're not as strong as those states. They are under-resourced in many ways, and oftentimes the source of funding is from the public sector. But we have seen the number of matching service registries over the last few years decrease. I think they exist right now possibly around in 10 states, though that number may have shifted up or down recently. And so this is a real opportunity for states to invest in developing or just enhancing their matching service registries to be as strong as possible, right? To make sure that they reflect the latest technologies, that their interfaces are as user-friendly and as modern as possible, and that they're capturing the right data in the right ways, right? In an equitable, kind of privacy-oriented way as well. Finally, there's a notion in this that there should also be allowed cooperation between self-directed programs and labor organizations. So in states where that relationship can be strengthened, this is an opportunity for the Act to fund that and to do that. Next slide, please. There is a provision, a series of items in the Better Care, Better Jobs Act that would also strengthen the federal leadership on this kind of goal or project to expand HCBS and strengthen it. Also, really, one, to share knowledge and to sort of both, you know, from the federal government to states, but also across states, right? And to also improve consistency and coordination across HCBS programs. I think it goes without saying that there's wide variance in programs, HCBS programs state to state and region to region. And we see it also within the workforce, where the training requirements, as one example, vary considerably from state to state, and they vary within states based on occupation and based on employer, right? So this is an opportunity for the federal government to really lead and advise on what that coordination and knowledge sharing looks like. Specifically, it would require the U.S. Department of Health and Human Services to submit an initial report to Congress that summarizes the challenges facing HCBS and its workforce across the country, as well as subsequent reports on those challenges and where progress has been made and where it hasn't. So this is an opportunity to just keep learning, keep the dialogue going, and for states, again, to inform what is the federal knowledge and the monitoring of this system. It also requires that HHS coordinate with the U.S. Department of Labor and with the Centers for Medicare and Medicaid Services to issue stakeholder-informed federal and state level recommendations. And this is huge. I mean, And one of the reasons that these three agencies are included in this is that depending on the issue at hand in the system that we're discussing, these agencies and probably a few others, the responsibility lies with each of these agencies. And sometimes that coordination isn't as strong as possible, right? And so if we're thinking about, for example, how to transform the training landscape as one example of the direct care workforce nationwide, it's going to require coordination across HHS, the US Department of Labor, and CMS because of different funding sources, because of different laws and rules, et cetera, and different funding streams. The same with compensation, the same with a few other issue areas. So it's great to see that there's a real interest in coordination across agencies. Next slide, please. Another piece of this is specifically around quality and accountability. So the Better Care, Better Jobs Act requires that HHS, this is again, the US Department of Health and Human Services, develop, publish, and regularly update a set of core and supplemental HCBS quality measures, including workforce measures. So there's been work that's already been done in the nonprofit sector, and I think to some extent in the public and private sector, from organizations like the National Quality Forum, which brought together stakeholders and looked at what should those quality measures look like in the home and community-based services system. And there include in those measures a few workforce-related ones. That said, there are advocates in the field and others in the workforce space who would argue for very specific workforce measures, everything from job satisfaction to turnover rates to vacancy rates, any kind of measure that would tell us to what extent the quality of HCBS has improved, remained stagnant, or decreased, right? And the more we look at quality, not just quantity, I think it's just a much more true picture of what the system looks like. The Better Care, Better Jobs Act also requires that states themselves issue regular reports on their infrastructure improvement plans. Again, these are the plans that I mentioned at the very beginning. It's $100 million nationwide. They would need to demonstrate increased availability of HCBS, that it has become more accessible for more and more people at the state level, that there are disparities among consumers that have been reduced, and that they have reached competitive wage and benefit levels for the majority of direct care workers, among other accomplishments. And this is important in that, again, it's moving the language from living wage and benefit levels to competitive wage and benefit levels, acknowledging that too often employers are competing unsuccessfully with retail, fast food, and other industries. And so states really need to think about that market and how it's affecting workers. Next slide, please. I think this is the final slide on the Better Care, Better Jobs Act, but there is an interest in really promoting innovation in HCBS. So I have had regular conversations over the years at PHI with really exciting innovators across spaces, in the tech space, in different sectors of the system, to really think about how do we innovate in a way that improves access for consumers, but also improves jobs and makes it easier to deliver these services among employers. And two pieces here is that the Act would mandate a federal study of the changes that are made to service delivery during the COVID-19 pandemic. We know, for example, and many of you can testify to this, that because of the emergency crisis and the fact that it was an unprecedented pandemic, many agencies and states had to implement a number of measures, right? Unfortunately, too many people died, too many people were infected, and it did strain a lot of budgets and services and settings. And of course, we've also seen many agencies close. And so this is a good way for the federal government to study what was implemented during this time, during the height of the pandemic, since we're still in the pandemic, right? And to assess what are the changes that need to be reassessed? What are the ones that need to be transformed? And how should we move forward so that we're better prepared in the future with any other kind of health crisis? The second is that we should document the Better Care, Better Jobs Act requires this federal study could document the impact of short-term workforce investment. So across states, we saw many states implement hazard pay measures or, childcare improvements, paid sick days, et cetera, that could translate into permanent investment. So as we think about what that federal study should cover, we just need to make sure that we explore what were the short-term workforce investments that again should remain, which should be strengthened, and which should go away. Next slide, please. So I just want to close with a few comments on what this means for our sector, and then I look forward to the questions and the ideas and conversation that follows. In January of this year, PHI released what we would consider our signature report at this point on this workforce. It's called Caring for the Future, the Power and Potential of America's Direct Care Workforce. It is available on our website at phinational.org, which I'm sure we can include that in the chat or as a follow-up. But it includes a wide range of recommendations, as well as a deep analysis on all of these issues, plus much more. And so I would encourage people. But I want to share my final thoughts aligned with this report. Next slide, please. So the report does issue recommendations across 8 areas, including how do we reform long-term care financing. So many employers are shaped and in some cases restricted by the financing mechanisms, the rules, the lack of funding, the reimbursement rates, et cetera. And we outline a range of recommendations that could really strengthen this financing system, specifically to improve direct care jobs. We also outline what the involvement should look like at the federal and state level for increasing compensation, broadly defined to include wages and benefits and other measures. How do we strengthen training standards and the full infrastructure for these workers? How do we better fund workforce interventions, like so much of what CareAcademy and other people on this call do and what PHI does? How do we improve data collection so that the research and knowledge on this workforce improves as well? How do we center direct care workers in policy and practice so they're bringing their wisdom to this sector? How do we rectify structural gender and racial inequities so that specifically women of color and immigrants in this sector have an equal opportunity to succeed in these roles? And how do we shift the public narrative to talk about all of these topics in ways that really build attention and awareness, but also popular and political support? Next slide, please. The key recommendations, because we are talking about the Better Care, Better Jobs Act, which has a heavy emphasis on compensation in this report, are about paying direct care workers a competitive wage, not just a living wage, improving access to full-time schedules, strengthening the social safety net and improving access to workplace benefits, and also evaluating the unintended impact of wage increase measures. So as we think about how do we raise the floor on wages with different policy or practice-based approaches, we should be at least accounting for what would be the impact in a system that's so reliant on Medicaid, in a time in which that system of funding is increasingly strained, right? Before we make those measures, and of course, if those measures have been made after the fact. Next slide, please. Finally, we did issue a report 2 weeks ago with federal recommendations that outline a variety of ways in which the White House, Congress, and key departments and agencies can really strengthen these jobs. Next slide, please. Losing my voice a little. Our federal recommendations related to financing, we of course talk about the importance of protecting and strengthening Medicaid so that funding levels are larger for states, but also that we address some of the pay inequities in those streams. Also, we need to look at alternative financing models. We've seen a number of states either pass or explore social insurance programs for long-term care, which can make a real difference for consumers, and they wouldn't be required to spend down their income and assets to qualify for Medicaid as one example. And there's an opportunity for federal reform in that regard. How do we improve HCBS access and workforce plans? And that has primarily all to do with the Better Care, Better Jobs Act, which you can all advocate for over the next few months. Public investment standards and value-based payment, as Medicaid managed care becomes a bigger part of the landscape in so many of our states, there's a way in which the federal government can address this, this emerging or this growing framework, I should say at this point. Next slide, please. Compensation, we of course would argue for the enactment of the Better Care, Better Jobs Act, the enactment of the American Families Plan, which would expand paid leave and paid family and medical leave, which among other benefits. We would argue for a national compensation strategy at the federal level that brings together various agencies and various stakeholders to basically lay out a plan for improving compensation for these workers in the long term, and that would take into account the Medicaid rate setting process, a competitive wage, benefit cliffs and benefit plateaus, which is a phenomenon where low-wage workers, if they make past a certain amount, begin seeing a decrease in their public benefits, which might disincentivize the number of hours they're able to work, right? And so how do we address those quirks? And also state and regional public authorities that might be a better structure for just financing and accountability at the state level on these workers. Next slide, please. We also have seen a number of innovations, and here is where I would suggest some next steps and some opportunities for those of us on the call. I can speak in more depth about this, but as this infrastructure package passes in the next few weeks, there's an opportunity for us to really focus on making sure that the Better Care, Better Jobs Act, the Build Back Better approach that would really make a difference in the system also passes, specifically through what is called the budget reconciliation process this fall. And so certainly advocating for this reconciliation bill, making sure the Build Better Care, Better Jobs Act is included in that, reaching out to our members of Congress about why this money is needed, depending on your vantage point, certainly looking for funding for states and for employers, and keeping an eye on future federal opportunities. The Direct Care Opportunity Act, which would invest about $1 billion in workforce measures, is certainly an opportunity. And also we are seeing potentially over the next few months and few years, kind of other funding opportunities for employers across the system, through other mechanisms and other agencies that we can certainly keep track of, and making sure that we're talking to our members of Congress about that state to federal interplay and why it matters so much to our states and our communities, and working with them also to define the parameters so that, we're reaching rural states, we're reaching technology and other interventions, we're investing in evidence-based approaches and so forth. Next slide, please. Some of these federal bills include the American Families Plan, which I already mentioned, and the American Jobs Plan. Again, I mentioned the Direct Care Opportunity Act, but also the U.S. Citizenship Act of 2021 would provide an earned pathway to citizenship for about 11 million undocumented immigrants, including essential workers, which includes direct care workers. So that's another way in which we can support immigrants in this sector, but also build the pipeline so that we can fill these jobs in the years ahead. Next slide, please. I'll close with this quote from Marisol Rivera, who is a care coordinator in the Bronx that we work closely with. She said, "I think the role of the home health aide should be considered just as important as any other healthcare role." And I love that quote because it really speaks to the importance of addressing the misrepresentation of these workers and the devaluing of these workers. They are just as important, especially to older adults and people with disabilities, but also to our economy and our healthcare system. So I'll end with that quote. And then the next slide is just a quick slide on our website, phinational.org, where you can access a range of resources. You can sign up for regular updates and join our conversation online. Thank you for your attention. I look forward to your questions and to the conversation that follows.
Thank you so much, Robert. That was such a wonderful and thorough presentation, and I really think that you got at a lot of the aspects and a lot of the opportunity that the BCBJA, or Better Care, Better Jobs Act, posits for us as an industry. We did get a couple of questions that came in, really good ones, really interesting, thought-provoking ones. We'll start out with a question about recent legislation in general. A lot of different acts have come forward, and there are some similarities between the American Rescue Plan Act and the Better Care, Better Jobs Act, mainly in that sort of 10% federal matching increase. What's the difference between these two acts, and how can you expand on that?
Yeah, absolutely. So the American Rescue Plan was specifically in response to the COVID-19 pandemic. It was an investment in kind of relief and recovery and helping states identify what is the best way to continue to go through, hopefully, the final stage of the pandemic, though I know that there are still a lot of health questions regarding the pandemic. And it allowed states to really define through spending plans how they would do that. I believe it's 1 year of funding, and states are putting together their spending plans. They would then submit their plans to CMS, and they would negotiate and talk through kind of through an iterative process with CMS with how that spending can be used. Many of these plans that I've seen include substantive improvements for the direct care workforce and for home and community-based services. In New York, the spending plan that has been proposed to CMS under the American Rescue Plan is a little over $2 billion, and it includes, I believe, $1.2 billion for improvements for the direct care workforce, and it spans a variety of issue areas. North Carolina has also introduced one, and they have also similar proposals for improving home care jobs, issuing a survey on the direct care workforce to get original data, and a few other measures. So the American Rescue Plan is very much, it's a 1 year investment, and it's dictated at the state level through CMS. The American Jobs Plan, or the Build Back Better plan, the Better Care, Better Jobs, is what I just described, and that's really about changing the landscape on HCBS, and it includes the $100 million for HCBS improvement plans and all the other measures that I addressed. By the way, I want to put out a third one, and I mentioned it briefly, which is the Direct Care Opportunity Act, and I testified before Congress a few weeks ago on this act, and this is a $1 billion investment, so it's comparatively smaller, though $1 billion is still quite a bit of money. And that's really about strengthening the evidence base on workforce interventions and coordinating it at the federal level. So it's an opportunity to really invest at the federal level in the interventions that are cutting edge, that are making a difference, that could really be evaluated and ideally replicated and brought to scale across a variety of issue areas. And it's specific to recruitment, retention, training, and advancement. So if people have, if that bill becomes law, and there's a good chance it could happen in the fall, and you're leading an intervention that you believe, could make a difference, not just for the people you're serving, but for the full sector, that's an opportunity to really apply for funding. Yeah.
That's a really wonderful breakdown. And I like that you brought up some other legislation that's come forward too to support the workforce. I know that for home care agency owners and administrators that workforce challenges are affecting them and their business. And there's a lot of funding going into HCBS and the Medicaid rates at which they could be getting access to, increases in rates to be able to provide competitive pay, as you mentioned earlier, and not just a living wage. So what do we need to do in order to make sure that a person in any state has access to that sort of funding increase?
Yeah, it's both a federal advocacy need and it's a state advocacy need. I mean, certainly advocating for the Better Care, Better Jobs Act is probably the best opportunity right now because it would provide that permanent 10 percentage point increase to the FMAP rate, right? As well as the 2% increase around self-directed services. And I think, to the extent that I believe advocacy oftentimes begins at home. And so if there are members of Congress that people have access to or want to reach out to speak about why this attention on HCBS is so critical, now is the time. And really arguing, I feel like unfortunately some of the debate got stuck in, is HCBS infrastructure instead of just having a conversation, why is HCBS so important and why do we need more money, right? And I think if we can just shift it to that dialogue, I think that's a critical step for it. If and when the money is delivered, it's an opportunity to then advocate at the state level with the right departments about how those parameters and how that funding should be distributed. Yep.
Excellent. So if I'm an administrator of a home care agency, how do I provide input at a federal level?
That's a great question. There are a variety of home care associations that represent providers and employers. And so I think identifying which association is relevant to you as an employer and your organization, and all of them have federal advocacy arms and legislative affairs arms. I would say most of them, I shouldn't say all of them in case someone doesn't, but that's one great way. I still think that many lawmakers want to hear directly from employers, and they want to hear from consumers and workers and family members. So I think there's always an opportunity to reach out directly. And then I believe that a lot of the political discourse is happening online. It's happening on social media, it's happening through digital publications. And so, if you can contribute in that way, that's another way in which it can happen. Yeah.
It's so interesting. And it reminds me of how much it's surprising the federal government actually listens to stakeholder input. I know, especially during COVID, CMS released a number of waivers in direct response to both stakeholder groups as well as individual testimony as to what was going to alleviate the strains during the pandemic. So that's really good input. That brings me to another question. I know that training is a pretty consistent challenge for both the workforce to acquire good training as well as for administrators to deliver and stay compliant with training. What does all of this mean for training requirements?
Yeah, so I can imagine that in the Better Care, Better Jobs Act, there are opportunities for states to identify training challenges. And typically when we think about the training landscape and the training barriers that are facing direct care workers, there's a few critical areas there. One is, what are the requirements that have been instituted at the federal and state level, and where can they be strengthened? The biggest gaps are often with personal care aides, because there is a federal training requirement for home health aides and nursing assistants, but there isn't one for personal care aides. And it varies state to state, et cetera, right? There also aren't requirements for direct support professionals, which are the workers that support people with intellectual and developmental disabilities. So if states identify those requirements as something that needs to be addressed to be a stronger system, then it's an opportunity there, right? Another area is the training infrastructure. Typically, it's a lack of resources. And so how do we boost the training infrastructure so that, in-person programs and virtual programs or hybrid programs have the resources they need to deliver quality, adult learner-centered, well-evaluated training programs, right? And ideally, a training program should be rooted in core competencies, not in duration or number of hours, right there. And there are competency sets out there that say, here are the core skills that people need, and they should be at the entry level, but they should also be continuous and at times specialty, right? So if an HCBS improvement plan can identify what those training needs are and a plan forward with that investment, that's a big piece, because we want to be assured as consumers that workers have the right skills and the knowledge and confidence to deliver good services and supports, and workers deserve good training so their jobs are satisfying and they succeed, right? So, and employers of course need it as well. So it's a big piece of the solution.
Excellent. That's a really great response. I am curious then, where does this leave us post-act, pre-bill? We're talking about it, we're writing about it, we're supposed to be advocating for it. We've seen the funding amount sort of whittle away. What does this mean for the next step? I know that you've talked a little bit about doing federal advocacy, which sounds like it's really important for administrators to be able to raise their hand and say, hey, our voice is important as a group of agency administrators through national organizations. When does that timeline kind of run out? When do we think this act will pass?
Yeah, so I think in terms of the timeline of its enactment, I think that what I've heard and what has been reported in the press as well is that it seems to be, there were obviously some developments today on just the general infrastructure package, but that, I mentioned the infrastructure package, and then there's the reconciliation bill in the fall where the Better Care, Better Jobs Act could be instituted. So I do think the timeline is probably going to be between now and early mid-fall. And if we can continue to see bipartisan leadership on this, and we continue to see an investment in really boosting HCBS and direct care jobs, hopefully it'll be successful. And we will do as much as we can as well to make that happen. It will have an enormous impact on the HCBS system, on home care jobs, and on how we think about these workers. And it does have a permanent 10% increase in the HCBS funding, right? So I do think that that's long term. There are, of course, a variety of challenges that will need to continue to be addressed. And we produced a federal report 2 weeks ago that outlines a lot of the solutions. A few of the pieces that I would identify as, I think in the ideal, and I think many people in this sector who work closely on the direct care job would argue for roles that are universal, that are standardized, that are portable, where workers can work across settings and across states, so that we don't have different realities for personal care aides versus home health aides versus nursing assistants. And we don't have different opportunities for people in Mississippi versus New York, et cetera, right? And so I think the long-term goal is how do we create a standardized occupation, a universal role perhaps, that's portable, et cetera, and that has opportunities for advancement, stackable within direct care so that, you know, we don't lose people to other sectors, but for workers who do want to move beyond direct care for administrative opportunities or other healthcare roles. I do think we still need an investment in the public narrative. There are a lot of misrepresentations about these workers as low skilled, which is not true, you know, there's unfortunately some more hateful ideas around workers, you know, being thieves or needing to be regulated, and just some unfortunate misrepresentations that an investment in public education can make a big difference in shaping people's understanding of who these workers are, and the barriers that people are facing. I will say, by and far, you know, I'm sort of the person among my friends and family members, when they encounter a challenge, I'm the first person they reach out to, right? Who do I talk to? How do I find? And what they realize within the first week or so is how dysfunctional and unaffordable this system is, right? And I'm sure you all see this at CareAcademy and have developed a range of tools to sort of facilitate that process. But it speaks to how much work we still have as a country to making long-term care in the workforce as strong and as equitable as possible. The Better Care, Better Jobs Act will make a big dent in that, but it's a long-term solution, yeah, that's needed.
Thank you so much. That was a really thorough and thoughtful response, and I think you covered a lot of different areas there. Really appreciate that. Along those lines, and do you think that the Better Care, Better Jobs Act and other like legislation will encourage new and existing direct care workers back into the workforce? I know that there have been some really wonderful supplementary benefits for people that needed to step away from work. Do you think that this will inspire workers to get back into the business?
I hope so. I mean, I think what would inspire workers to enter this role is kind of a sense that these jobs are higher in quality, right? That they pay more, that there's good training and advancement opportunities, that they're being recognized and respected, and just supported in all the best ways possible. And so if the HCBS investment, you know, it transforms these jobs in those ways, I think we're going to see recruitment and retention increase as well. The other piece is that I would imagine that as part of these plans and as part of this funding, there will be a dedicated attention to recruitment and retention interventions beyond job quality improvements, right? What are all the ways in which we can better recruit and retain these workers through stuff like hiring and onboarding and et cetera, right? And so I do think that the more we invest in those innovations, hopefully we'll be able to better recruit. Yeah.
Thank you. Switching gears a little bit back to Medicaid rates, what is the projected impact for state Medicaid rate improvement?
Oh, I'm not sure I understand that question in terms of.
I know it's kind of complicated because it's broad and every state kind of addresses Medicaid differently, and every state's application will look different to the state in how to acquire those funds and where they're focusing. But do we have any inkling about what the rate increase could look like?
Unfortunately, I don't. I'm assuming someone's done that analysis in our field, somebody who's kind of more focused on the Medicaid reimbursement rates. And it is a major barrier. I mean, it's the primary barrier that employers would put out, that, you know, if they're not being reimbursed sufficiently to even deliver services, it's even harder to improve jobs, right? But I unfortunately, I don't have the precise figure on that or analysis, yeah.
That's fair. Thank you for your candor, Robert.
No problem.
Another question, will the HCBS updates address the under the table market of in-home care workers?
Not as it's currently defined in the Act, as far as I know. I mean, I read it a few times and I didn't see any references to what we might call the gray market. But it is an area that needs to be addressed. I mean, there's no research on the gray market that beyond kind of theoretical research, right? There's no data on who these workers are, what are the challenges they're facing, and what are consumers facing? How does it impact private, agencies, all of that? It is one of our recommendations in our federal report that the federal government issue or commission a study on the gray market, which would include, undocumented immigrants who are working in the sector, but anyone, right? Because we need that information to get a better sense of how it's affecting consumers, workers, and employers. But I don't believe it's currently named in the Act, although nothing prevents the state from exploring that. No.
Interesting. So hypothetically, a state in their individual approach could address it. And any data is good data in this case, as you alluded to. There's not a lot of information on the gray market. There's not a lot of information in general. And it's really, organizations like PHI that have kind of led the charge in gathering data on this more or less patchwork of regulated market. Thank you so much, Robert, for your thoughtful response. We're coming up to the top of the hour, and I'm going to be sensitive to people's calendars. I don't know about you, but I see that block of meetings, and I want to be sure to be sensitive of everyone's time. So I will bid you adieu. Thank you, everybody, for coming. Robert? Yes. Thank you for joining us.
Thank you.
We do have an outcomes research study that you can look forward to attaining from CareAcademy in a follow-up message. We found with caregiver confidence, it surges up to about 71% after CareAcademy dementia care training. So speaking of data, we're working on it here a little bit at a time. So thanks again, everybody, and thank you, Robert. Everybody have a wonderful day.